Please be aware that this video is intended as an educational resource only and should not be used as personal medical advice. All decisions about the management of your health or condition should be made in conjunction with your specialist or medical professional. So, what is arthroscopy? Arthroscopy is a type of keyhole surgery, a minimally invasive surgical procedure that is performed through small incisions in order to evaluate or treat a variety of conditions. So, what is an arthroscope? An arthroscope is a small tube that contains optical fibers and lenses, with a digital camera that can be inserted into the body, giving doctors a view of inside your joint. To better understand your arthroscopy procedure, we should take a few minutes to learn a little bit about your anatomy, the procedure, the risks and issues involved. So, let's start with the anatomy of your hip. Your hip is where your thigh bone, or femur, meets the pelvis. It's a ball and socket joint. The ball is on top of the femur or thigh bone, and the cup-shaped socket on the pelvis is called the acetabulum. Both surfaces of the joint are covered by a smooth, slippery surface of articular cartilage that allows free movement. This articular cartilage cushions the joint and allows smooth hip movements. Articular cartilage is not visible on X-rays. Therefore, you normally see a joint space between the top of the femur and the acetabular socket in your hip. Your pelvis. Your hip is part of the pelvis, a bowl-like collection of bones, with each side of your pelvis actually being made up of 3 bones, the ilium, the ischium, and the pubis. The acetabulum is the socket in your pelvis, joining the top of the thigh bone or femur to the pelvis, thus creating the hip joint. The femur. The thigh bone or femur is the longest bone in your body. It connects the pelvis via the acetabulum socket to form the hip joint. The upper part of the femur is composed of the femoral head, the febrile neck, and the greater and lesser trochanter. So, why might you need an arthroscopy? An arthroscopy may be used for diagnosis and evaluation of patients experiencing unexplained pain, swelling, stiffness, or instability that is proven unresponsive to conservative or non-surgical treatment. Further, arthroscopic surgery may be required or suggested for one or more of the following reasons. Debridement of joint surfaces or loose bodies. Debridement is the medical term for removal of dead, damaged, or infected tissue to improve the healing potential of the remaining healthy tissue. Typically, a hip arthroscopy could be performed to remove bone chips or torn cartilage debris causing hip pain and decreased mobility, or a condition such as arthritis that can cause the breakdown of tissue or bone in the joint. Removal of adhesions. Adhesions are scar tissue that is built up, limiting movement and causing pain. Repair of a torn labrum. The labrum is a fibrous rim of cartilage that surrounds the hip socket or acetabulum to ensure a good fit and hip stability. Removal of bone spurs. A bone spur is a tiny pointed outgrowth of bone, typically caused by injury, tendinitis, arthritis, that damages the ends of the bone, causing pain and limiting joint mobility. Partial synovectomy. Removal of portions of inflamed synovium or joint lining in patients with inflammatory arthritis can help decrease the patient's pain. However, a complete synovectomy requires an open and larger hip incision. Trauma repair. The repair of fractures or torn ligaments caused by trauma. We begin with your diagnosis. Firstly, an orthopedic surgeon will examine and evaluate your hip symptoms to ensure a proper diagnosis in order to provide the best treatment outcome. Your orthopedic surgeon will discuss and record your medical history, perform a physical examination, request diagnostic studies such as X-rays or MRI. An MRI is magnetic resonance imaging, where magnetic and radio waves are used to create a more detailed computer image of soft tissue, nerves and ligaments. Your orthopedic surgeon could also suggest more conservative treatment options such as prescribing anti-inflammatory medications, referring you for physiotherapy, suggesting rest, suggesting you limit certain activities, or an injection of steroids and analgesics directly into the hip joint. During your procedure. During your surgical procedure, an arthroscope will be inserted into your joint to assess and repair any damage. Even though the arthroscope and other surgical instruments used are very small, typically only 3 to 4 millimeters in diameter, the high-definition camera attached to the arthroscopes displays the image on a large screen, allowing the surgeon to see every part of your hip joint and to assess the type and amount of injury and repair or correct the problem as needed. The major benefits of arthroscopic surgery compared to traditional open hip surgery include less pain, much smaller incisions, faster healing time, less scarring, lower infection rate, minimal soft tissue trauma, faster return to full mobility, and is typically performed as outpatient or day surgery. Your surgery will be performed in a hospital operating room under general or local anaesthetic depending on you and your surgeon's wishes. To begin the surgery, your surgeon will make 2 or 3 very small incisions, only about 3 or 4 millimeters each, around the hip joint. Each of these incisions is called a port and result in very small scars that normally will be barely noticeable. Then a blunt hollow tube called a trocar is inserted into each incision or port. The trocar holds the incision open and allows access without the potential for additional trauma caused by the insertion and removal of the arthroscope and any other surgical instruments. Then, the arthroscope is inserted through the trocar to view the hip joint. A sterile solution is pumped in to enlarge the viewing area like a balloon, allowing the surgeon a clear field of view and to work. Using the images from the arthroscope's display screen, your surgeon will assess the hip joint and determine the extent of your injuries and perform the required surgical procedures as needed. After treating your condition, the port or incisions are closed by suturing with stitches or with surgical tape. And best of all, arthroscopy is proven to be much less traumatic on the muscles, ligaments and tissues than more traditional methods of open surgery. After surgery, your surgeon will provide you with a post-operative course of action to aid your recovery. This will depend upon the type of surgery performed. Your post-operative plan may include specific instructions regarding your lifestyle, activity or rehabilitation, prescription medications to keep you comfortable at home, instructions about wound care and bathing. Typically, you may shower once the dressings are removed unless otherwise directed by your surgeon, and physiotherapy if required to restore normal function and strength. Benefits and risks. As with any surgery, there are always potential risks. Your decision to proceed with the surgery is made because the advantages of the surgery outweigh the potential disadvantages. It is important that you are informed of these risks before the surgery takes place. Complications can be medical, general, or specific to the hip arthroscopy surgery. Medical complications include those of the anaesthetic and your general well-being. Potential complications. It should be noted that the vast majority of patients suffer no complications following hip arthroscopy. However, complications can occur with any surgery and may include allergic reactions to medications, blood loss requiring transfusion with a low risk of disease transmission, heart attack, strokes, kidney failure, pneumonia, and bladder infections. Complications from the use of nerve blockers, such as infection or nerve damage, serious ongoing medical problems or concerns, leading to prolonged hospitalization or very rarely death. Specific complications. Infections. Infections at the incision or portal insertion site, or a more serious infection within the joint space of the hip. Nerve damage, tingling, pain and weakness from nerve damage or nerve trauma. This may be temporary or permanent and can cause numbness. Hemarthrosis, excess bleeding into the joint or surgery site. This may require additional arthroscopic surgery to irrigate the joint and evacuate or drain the blood. Blood clots or deep vein thrombosis. These typically form in the calf muscles and can travel to the lung, causing a pulmonary embolism, These can occasionally be serious or even life-threatening. If at any stage you get calf pain or shortness of breath, you should notify your surgeon immediately. The failure to relieve pain. This is rare but may occur, especially if pain is coming from other areas, such as the spine. There are risk factors that can negatively affect your healing after surgery, including general ill health, poor nutrition, smoking, obesity, diabetes, age, over 60, alcoholism, chronic illness, and steroid use. Weighing this all up and having a good understanding of the procedure is important. If you have any doubts, questions or queries, please consult your specialist or medical professional. If you'd like to find out more about Online Medical's videos or find out about getting your own branded content, contact Online Medical today, 1300 900 155.